Good evening, everyone. Today's topic is anti-cancer drugs. Practically, this chapter is very much boring, irritating, and tough. But you have to face more than 1000 MCQs from this chapter for NEET PG. But for second prof MBBS, you have to remember few very important drugs for theory and viva. Don't try to remember all the drugs, all the indications and all the side effects. But don't panic. Examiners usually ask gross question in viva, that is Goda question. Okay. So first of all, what is cancer? Cancer is a genetic disease caused by DNA mutation. Simply, abnormal growth pattern and uncontrolled cell division. Okay. So all of you know there occurs many cancers or carcinomas from head to toe, and there are many drugs in this chapter. And all of you know that treatment of cancer is mainly surgery or radiotherapy or chemotherapy or immunotherapy. And this is the term chemotherapy. What do you mean by chemotherapy? Chemotherapy means drugs used to treat cancer or carcinoma and drugs used to treat any infectious diseases, that is antimicrobial agents. So chemotherapy, layman's usually কি বলে কেমো চলছে, that is cancer treatment চলছে, but chemotherapy means drugs for carcinoma and drugs for antimicrobial agents. As I told you, cancer means uncontrolled cell division. So first you have to know cell cycle. What are the phases of cell cycle? G0, that is resting or non-proliferating pattern. G1, pre-synthetic phase. S for synthetic phase, and here DNA synthesis occurs. G2, post-synthetic phase, and M for mitotic phase. Cell cycle is like that: G1, S, G2, M, and again G1. One example, আমি বাড়িতে ঘুমাচ্ছি, ওকে। সো আমি G0 ফেজে আছি, আমাকে ডেকে তুলে বললো যাও বাড়ি থেকে মার্কেট থেকে বাজার করে নিয়ে এসো। মার্কেট থেকে কিছু মেটেরিয়াল নিয়ে এলাম, দ্যাট ইজ প্রি সিনথেটিক ফেজ। এস, যেখানে ডিএনএ সিনথেসিস হচ্ছে, তার মানে বাড়িতে কিছু খাবার দাবার রান্না হলো সেই মেটেরিয়াল দিয়ে। পোস্ট সিনথেটিক ফেজ, তার মানে সেখানে কিছু কারেকশন হলো, একটু নুন বেশি হয়ে গেছে সেটাকে কম করা হলো, একটু ঝোলটা একটু বেশি হয়ে গেছে সেটাকে ড্রাই করা হলো, দ্যাট ইজ G2। অ্যান্ড এম ফর মাইটোটিক, সেখানে ডিস্ট্রিবিউশন করা হলো, সেল সাইকেলে আসলে মাদার সেল থেকে ডটার সেল তৈরি হলো। সো দিজ আর দ্য ফেজেস অফ সেল সাইকেল। নাও classification of anti-cancer drugs. Note, few drugs are non-cell cycle specific. These drugs act upon any phase of cell cycle, maybe G1, maybe G2, maybe S, and this phase, number 2, these drugs act on specific phase of cell cycle, and most important phase here, S and M. So two types of drugs here. Few drugs act upon S phase and few drugs act upon M phase. These are the main classification of anti-cancer drugs. Usually, classification of anti-cancer drug is 1, 2, 3, 4. 1 is non-cell cycle specific, 2 is cell cycle specific, and I will discuss later about 3 and 4. These are so less first important. I will discuss non-cell cycle specific. Very carefully observe the classification. This is very important. I will discuss only important drugs, indications and side effects. So classification is very much important. There are many drugs and I will tell you which drugs you have to remember for your exam purpose in second prof MBBS exam. So first classification is non-cell cycle specific drugs. Non-cell cycle specific drugs. So first I am discussing this class 1 non-cell cycle specific drug. Carefully note the broad classification. Number 1, alkylating agents. Alkylating agents. Number 2, platinum compounds. Platinum compounds. And number 3, anti-tumor antibiotics. These are antibiotics but used to treat cancers. So these are broad classification: alkylating agent, platinum compounds and anti-tumor antibiotics. First I am coming to alkylating agents, and this group is very important for your exam purpose. Now again, alkylating agents are subclassified into nitrogen mustards, number 1, number 2, nitrosoureas, number 3, methylating agents, and number 4, miscellaneous. So nitrogen mustards, nitrosoureas, methylating agents and miscellaneous drugs, these all belong to alkylating agents. Now I will tell you very important drugs. For nitrogen mustard, very important drug is cyclophosphamide, ifosfamide, melphalan, chlorambucil. Try to remember these 4 drugs from nitrogen mustards. From nitrosoureas, these drugs are very important: carmustine, lomustine and streptozocin. Okay. From methylating agents, procarbazine and dacarbazine, these drugs are important. And from miscellaneous, remember only 2 drugs, busulfan and thiotepa. These 2 drugs are very important. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So my suggestion is to remember this, try to remember these 11 drugs as alkylating agents. Okay. And among these all drugs, most important and frequently asked drug in your exam is cyclophosphamide. So cyclophosphamide is most important alkylating agent for your exam purpose. Exam purpose means, again I am telling you, second prof exam purpose. Okay. Now first I am coming to mechanism of alkylating agents. Mechanism of alkylating agents. Note, alkylating agents, from alkylating agents, they produce carbonium ions, intermediate active carbonium ions, and carbonium ions form covalent bonds with different cellular constituents. Number 1, nucleophile substances. Number 2, some enzymes on RNA. And number 3, DNA. And this is the most important mechanism of alkylating agents. I am explaining you. This is one DNA and this is another DNA. Now alkylating agents bind to this region and bind to this region, and they form interstrand cross-linking. This is called interstrand cross-linking. Interstrand cross-linking. Interstrand cross-linking. And that results in breakdown of DNA. Why? Because after forming interstrand cross-linking, this is now considered a dimer, and enzymes recognize this complex as dimer and breaks down DNA, and this is the most important mechanism of alkylating agents. Okay, now you have to remember one important thing: the specific point where these alkylating agents, alkyl groups, not alkylating agents, because alkylating agents form carbonium ions, and carbonium ions provide alkyl group. These are alkyl group. Okay, these are alkyl group. Specific part of the DNA, it is known as N7 position of guanine. N7 position of guanine. And another mechanism is when alkyl group binds to N7 position of guanine, so guanine, thymidine, they form abnormal guanine and thymidine complex. Okay, and resulting in formation of defective DNA, and this defective DNA passes through check gate, abnormal base pairing. Okay, so check gate, if check gate is functional, check gate is functional, alkylating agents produce cytotoxic effect, or these drugs act as anti-cancer drugs, cytotoxic effect. But when check gate is not functional, they produce secondary carcinoma. One very important example is one type of leukemia, that is AML. So this is one mechanism, DNA damage. Another is abnormal base pairing, and all these mechanisms fall under point number 3, and you can use these terms. Number 1, actually this mechanism is main mechanism. Number 1, write in your exam paper, this is the number 2, form covalent bonds with nucleophile substances like sulfhydryl group, hydroxyl group, resulting in these are not available for metabolic reaction. Ultimate result is cytotoxicity. And number 3 mechanism is some enzymes and RNA. They form covalent bonds with some enzymes and RNA, and ultimate result is cytotoxicity. But in your exam paper, if you write only point 1, that will be enough. This is my opinion. Okay, but for better answer, you should write all the 3 points. So this is the mechanism of action of all alkylating agents. All alkylating agents. Okay, When examiner asks you, enumerate few alkylating agents, and usually you forget nitrogen mustard, these headings, okay, and you cannot tell name of any drugs. So my suggestion is, when in Viva examiner asks you enumerate few alkylating agents, then follow these mnemonics. If bus not present, take my cycle. Now you tell me, if for ifosfamide, okay, bus for busulfan, not for nitrosoureas, carmustine, lomustine. Present, P for procarbazine, take for temozolomide, this is tough name, temozolomide. My for melphalan, and cycle for most important drug, cyclophosphamide. Okay, again, enumerate few alkylating agents and you forget all the headings, so you cannot remember the name of the drugs. So remember these mnemonics: if for ifosfamide, bus for busulfan, not for nitrosourea or nitrosourea is okay, because cyclophosphamide and ifosfamide is there, so not for nitrosourea, carmustine, lomustine. And present, P for procarbazine, take for temozolomide, my for melphalan, and cycle for cyclophosphamide. Okay. Now be ready to face this question is second prof theory paper, cyclophosphamide, very important drug. Okay. Cyclophosphamide. Look here, this is the metabolism of cyclophosphamide. Cyclophosphamide is first converted to 4-hydroxycyclophosphamide. This is not important. And 4-hydroxycyclophosphamide is converted to inactive metabolites, aldophosphamide and chloroacetaldehyde. Among these, this is the most important. Okay. So cyclophosphamide ultimately converts to aldophosphamide. From aldophosphamide, one compound is formed, that is phosphoramide mustard, and this compound is responsible for anti-cancer effect of cyclophosphamide. And from aldophosphamide, another compound is formed. This is dangerous, acrolein, and this causes hemorrhagic cystitis. Cystitis with bleeding. Okay. So for anti-cancer effect, this compound is responsible, and for hemorrhagic cystitis, this compound is responsible. Now in your Viva table, there is a very catch question, frequently asked question. Hemorrhagic cystitis is caused by which drug? One is cyclophosphamide, another is ifosfamide. Can you remember the second drug? Here, cyclophosphamide, ifosfamide. These two drugs cause hemorrhagic cystitis, and this is very frequently asked question in exam. And again the second question is, which compound is responsible for hemorrhagic cystitis? Acrolein. This is very important question for Viva. Hemorrhagic cystitis is caused by acrolein, which is formed from cyclophosphamide. Okay. Now, next question is, how will you treat the hemorrhagic cystitis? Hemorrhagic cystitis is treated by one compound. Name of the compound is mesna. This is enough. Hemorrhagic cystitis caused by cyclophosphamide ifosfamide. Compound responsible is acrolein, which is formed from cyclophosphamide, and treatment is mesna. And this is the chemical name of mesna, 2-mercaptoethane sulfonate. If you think this is tough, don't remember. Okay. But you have to tell mesna. Acrolein, hemorrhagic cystitis, cyclophosphamide, mesna. Remember this frequently asked question is Viva. Now, this is another question. Cyclophosphamide uses. I have told you all the anti-cancer drugs have specific indications and specific side effects, but you have to remember few. Okay, so try to remember indications of cyclophosphamide, because cyclophosphamide is very important drug. Non-Hodgkin's lymphoma, breast carcinoma, ovarian carcinoma. Okay, and these are carcinoma related to cancer, but non-carcinomatous condition, Wegener's granulomatosis. Wegener's granulomatosis. This is one disease of blood vessel, will be discussed later. Remember, and there is nephrotic syndrome, steroid dependent nephrotic syndrome. In steroid dependent nephrotic syndrome, cyclophosphamide is drug of choice. And another question, nephrotic syndrome which is steroid resistant. Steroid resistant nephrotic syndrome, drug of choice is cyclosporine. Okay, so these are the indications of cyclophosphamide. Next is ifosfamide. Okay, come to this slide, and here you can see cyclophosphamide causes hemorrhagic cystitis and also neurotoxicity. So two side effects of cyclophosphamide, hemorrhagic cystitis and neurotoxicity. These two side effects, same side effects, is also seen with ifosfamide. Okay, ifosfamide. Ifosfamide is used in testicular carcinoma, osteocarcinoma. And I have written few nitrogen mustard compounds indications, but remember, I am telling you, remember, melphalan is used in multiple myeloma. Don't read this. Melphalan is used in multiple myeloma. Okay, and cyclophosphamide is used in breast carcinoma, non-Hodgkin's lymphoma and ovarian carcinoma. Apart from this, steroid dependent nephrotic syndrome and Wegener's granulomatosis. So from here I have told you 3 lines. Cyclophosphamide, overall alkylating agents, mechanism action of alkylating agents, cyclophosphamide side effects, hemorrhagic cystitis treated with mesna. Same here, ifosfamide causes hemorrhagic cystitis, which is treated with mesna, and one drug, that is melphalan. Okay. Now side effect of ifosfamide, again neurotoxicity and hemorrhagic cystitis, and forget about this. Okay. Next, Next, I will discuss nitrosoureas. Okay. So nitrosoureas, okay. Nitrosoureas, number 2 alkylating agents. Example, carmustine, lomustine, streptozocin. Okay. Remember only few lines. Carmustine, lomustine, these drugs are used in brain tumors. These drugs are used in brain tumors, and their side effects are sustained neutropenia. This is one side effect, and another is neurotoxic. And another drug is streptozocin, which is the drug of choice in pancreatic beta islet cell carcinoma. These only two lines. Okay. If you think this is tough, forget about this, but try to remember this streptozocin is drug of choice in this carcinoma. Next, so I have finished nitrogen mustard, nitrosoureas. Now, methylating agents. Example, procarbazine, dacarbazine. Come to here. These carbazines are used in Hodgkin's disease, and side effects of these drugs are monoamine oxidase inhibition and disulfiram like reaction. And here one drug, temozolomide. This drug is drug of choice for brain tumor. Okay. So if you think nitrosoureas are tough, methylating agents are tough, don't read. But be ready to face question from cyclophosphamide in second prop theory and viva. This is very important. Okay. Now, the last group of alkylating agents, I have told you to remember only two names, busulfan, thiotepa. This busulfan is used in CML, one type of, all of you know, AML, ALL, CML, CLL. So busulfan is used in CML, and this is very important question. Don't take it casually. Busulfan, side effect of busulfan is pulmonary fibrosis. This is another frequently asked question in Viva or MCQ. Pulmonary fibrosis is caused by busulfan. Okay. Now, my next question is, pulmonary fibrosis is not only caused by busulfan. There are many other drugs. Remember these drugs. All these drugs cause pulmonary fibrosis. Okay. All these drugs, side effect of all these drugs is, one side effect is pulmonary fibrosis. This is very easy to remember, I am telling you. All these drugs are related to vehicle. Look here, carmustine, car, cyclophosphamide, cycle, busulfan, bus, methotrexate, taxi. Okay. Bleomycin, bleo for blow, blowhorn, bleomycin. Amiodarone, drone. Okay. So all these drugs are related to vehicle, and all these drugs cause pulmonary fibrosis. So till now I have discussed alkylating agents, mechanism of action, nitrogen mustard, nitrosoureas, methylating agents, and miscellaneous agents. Now, this was number 1, this is number 2, and this is number 3. Now I will discuss number 2 classification. That is, number 2 is platinum compounds. Look here, platinum compounds. Very good example is cisplatin, carboplatin. Cisplatin, carboplatin. Platinum compounds. Okay. Now indications. Cisplatin and carboplatin. Both drugs are used to treat lung carcinoma, GIT carcinoma, urogenital carcinoma, head neck carcinoma. Okay. Cisplatin, carboplatin, these two drugs are used to treat these carcinomas. And oxaliplatin is used to treat colorectal and pancreatic carcinoma. If you think this is tough, this is not easy to remember, you can omit this, no problem. But this is very important for platinum compounds. Most important is cisplatin. Side effects, I am telling you repeatedly, be serious about cisplatin. This is one very important drug, especially side effects. Nephrotoxicity, neurotoxicity, ototoxicity, and emesis. And there are few frequently asked questions in Viva. I am telling you this. Nephrotoxicity. Nephrotoxicity is treated by 1 to 2 liter of normal saline, which causes chloride diuresis. This is one question. Nephrotoxicity, how cisplatin induced nephrotoxicity is treated. This is the answer. And second frequently asked question is emesis, because all anti-cancer drugs cause more or less nausea, vomiting. That is emesis, more or less. But cisplatin causes maximum emesis. Maximum emesis or maximum nausea, vomiting causing anti-cancer drug. Among all anti-cancer drugs, cisplatin causes maximum nausea, vomiting. So you have to remember this. And treatment is 5-HT3 antagonist, you know, ondansetron. Ondansetron is used to treat cisplatin induced nausea, vomiting. Carboplatin, important side effect is bone marrow suppression, and oxaliplatin, peripheral neuropathy. But these are not very much important. Most important is cisplatin emesis. Okay. Now I have discussed this, and last, that is anti-tumor antibiotics. Carefully note two subclassification, anthracyclines and others. Among anthracyclines, important drugs are doxorubicin, daunorubicin. These two are very important drugs, anti-tumor antibiotics. And here 3 drugs are important. Actinomycin D. Another name of actinomycin D is dactinomycin. Mitomycin C, bleomycin. So here you have to remember 5 anti-tumor antibiotics: doxorubicin, daunorubicin, actinomycin D, mitomycin C, and bleomycin. And here is a chart. Don't try to remember everything. In this chart, one group is anthracyclines and anti-tumor antibiotics, and another is others. Here I have written mechanism of action of all these drugs. My suggestion is don't try to remember this, okay? Focus. Doxorubicin. Another name of doxorubicin is adriamycin, okay? If possible, I don't think it's possible to remember all the carcinomas. So try to remember doxorubicin or adriamycin. Important side effect is cardiotoxicity and red urine. Okay. Next, donorubicin. Donorubicin. Here also side effects are cardiotoxicity and red urine. Next, my suggestion is remember bleomycin. I have already discussed bleomycin causes pulmonary fibrosis. Apart from this, if possible, try to remember flagellate dermatitis, one special skin condition, and Raynaud's phenomenon. These three are side effects of bleomycin. Actinomycin D or dactinomycin. Side effect is radiation recall syndrome. Okay, I will discuss later what is radiation recall syndrome. This is not important. And mitomycin C, side effect is hemolytic uremic syndrome. Hemolytic uremic syndrome. This is another disease related to blood vessel. So from this slide, try to remember doxorubicin, donorubicin causes cardiotoxicity, bleomycin causes pulmonary fibrosis, actinomycin D causes radiation recall syndrome. These four will be enough, I think. Okay, so now I can tell you that I have completed this non-cell cycle specific drug. They can attack any stage of cell cycle, maybe G1, S, G2. Number 1, alkylating agent. Number 2, platinum compounds. Number 3, anti-tumor antibiotics. Alkylating agents, there are 4 subclassification, and under anti-tumor antibiotics there are 2 subclassifications. So I have finished this group. This was the first group, non-cell cycle specific drug. Okay, now I will discuss cell cycle specific drugs.